These abbreviations are used during the video.
The patient is positioned in supine position with the leg extended and relaxed and the hip in neutral position. The transducer is placed vertically over the proximal 1/3 of the lateral thigh. Identify the round surface of the femoral bone and adjust the probe to bring it in the center of your screen. Be sure to be distal enough of the greater trochanter. The muscle around the femoral bone is the vastus lateralis. It is covered by a strong aponeurosis, which is prominent in its dorsal part. Directly adjacent is the iliotibial band. At this level, these two layers often cannot be distinguished from each other. From here, move the probe in a lift technique, proximally towards the greater trochanter, till you reach the vastus tubercle. Notice the separation of the vastus aponeurosis and the iliotibial band. The arrow indicates the vastus aponeurosis. At the level of the vastus tubercle, the vastus aponeurosis is prominent and again in close proximity to the iliotibial band. This becomes clearer in a longitudinal view. From the longitudinal view, we go back to the transverse view over the vastus tubercle and move the probe in a lift technique further proximal and slightly ventral over the ventral facet of the greater trochanter. In this way, we obtain a cross-section view of the gluteus minimus tendon. The probe or the rotation of the leg usually needs to be slightly adjusted to center the tendon in the middle of the screen. The arrow indicates the gluteus minimus tendon. The gluteus minimus tendon can be well depicted in a transverse view. Note the slight concavity of the ventral facet. The muscle covering the gluteus minimus tendon is the ventral part of the gluteus medius. Above it lies the iliotibial band. From here, we follow the gluteus minimus tendon in a lift technique further proximally into its myotendinotic junction. The aponeurosis of the gluteus minimus lies superficially on the muscle and has a fan-shaped structure. The fibers of the aponeurosis overlap in the insertion area, which is why the tendon is thick here. The dorsal fibers make a sharp turn of 70 to 80 degrees, which creates an acoustic shadow. The arrow indicates the gluteus minimus aponeurosis. The acoustic shadow of the dorsal fibers of the aponeurosis covers the underlying muscle of the gluteus minimus and the dorsal part of the hip joint capsule. The muscle above the aponeurosis is the gluteus medius, which borders ventrally to the tensor fasciae latae muscle. By moving the probe further proximally, the shadowing disappears, and by directing the probe towards the anterior iliac crest, you get a longitudinal view of the indirect tendon of the rectus femoris as the next landmark, indicated by the arrow. The indirect tendon of the rectus femoris lies beneath the gluteus minimus muscle and inserts at the supraacetabular ridge of the iliac bone. If you guide the probe from here dorsally, you get a good overview of the gluteal muscles. Note that the aponeurosis of the gluteus medius is located in the middle of the muscle, in contrast to the aponeurosis of the gluteus minimus, indicated by the arrows. This transverse view of the gluteus minimus and medius is important to assess the trophic of the muscles. The superficial gluteus minimus aponeurosis helps to separate these muscles from each other. A tiny part of the gluteus maximus muscle is seen dorsal and superficial to the gluteus medius. For a longitudinal view of the gluteus minimus tendon, it is best to go back to the transversal view over the ventral facet and turn the probe by 90 degrees. For optimal alignment, the transducer must usually direct it slightly ventral towards the anterior iliac crest. If you fall of the tendon during rotation, slight readjustment of the probe is needed, or you repeat from the start. In the longitudinal view, you can clearly see that the tendon of the gluteus minimus is very prominent in the insertion area. The muscle above is the gluteus medius. When moving the transducer towards the myotendinotic junction, the thick tendon seems to break, and you can only follow thin fibers towards the muscle. This phenomenon is due to the special, abrupt transition of the thick tendon into the flat, fan-shaped aponeurosis. The arrow indicates the breaking. Remember, the aponeurosis of the gluteus minimus lies superficially on the muscle and separates it from the gluteus medius muscle above. Don't mistake the break of the thick tendon as a partial rupture. It is an artifact,